Workers' compensation is less familiar to most of us than other social insurance programs. So you might be surprised to know that famous figures as diverse as Jane Addams, President Theodore Roosevelt, and pirates, yes, pirates, have played key roles in its history. Workers' compensation is the first social insurance program to have been enacted in the United States. And state programs, which were first established in 1911 and in the decade that followed, in response to a shift in public understanding driven by the Triangle Shirtwaist Factory fire and Upton Sinclair's The Jungle, are foundational to the US social insurance infrastructure. Indeed, as Academy member Michael Duff, the Winton S. Howard Distinguished Professor of Law at the University of Wyoming, recently noted, aside from workers' compensation, there is no nationwide short-term disability program in the US. And yet, the workers' compensation system resists paying occupational disease claims, leaving a real gap in that area of support for workers. So, as the opioid crisis, and even more recently, the COVID-19 pandemic illustrate, workers' compensation is both an essential component of our social insurance ecosystem, but also a problematic aspect of that system. And it is often siloed rather than spotlighted during important income and healthcare policy debates. A lot has happened in the century since the first states enacted their fairly primitive workers' compensation laws. Les Bowden, professor of public health at Boston University, and more important for our purposes, chair of the Academy's Workers' Compensation Data Panel for the past 3 years, will briefly describe the program's recent history and the Academy's role in it to kick off this session. Thanks, Les.
Good afternoon. Today, we are going to look back and look forward. We begin by looking back 50 years to the work of the National Commission on State Workmen's Compensation Laws. The National Commission was established by a Congress concerned that this state-by-state set of social insurance programs was not meeting its obligations to injured workers. Injured workers often have little or no liquid savings, so they must rely on workers' compensation cash benefits for life's necessities. 50 years ago, many states did not require employers to cover their workers, and when they were covered, many received inadequate benefits that left them often in poverty. The National Commission was created by a bipartisan Congress signed by a Republican president. Think about that. It published its report 50 years ago in 1972. John Burton was a brilliant choice to chair the commission. At the heart of the report were 19 essential recommendations. In essence, these recommendations boiled down to 2 things. First, all workers should be covered. Second, benefits should be adequate. At the time, these seemingly pedestrian goals were actually revolutionary for many state systems. Over the next 20 years, a growing number of states met most of the recommendations. The Commission was successful beyond many of our expectations. Coverage and benefit levels increased, and with them, so did premiums. Beginning in the early 1990s, driven by rising premiums, states began looking for ways to reduce employer costs. New legislation made it more difficult for injured workers to apply for and receive workers' compensation benefits. These laws increased the burden of demonstrating work-relatedness and reduced the range of disabilities considered work-related. They decreased premiums by reducing the ability of injured workers to access benefits. This erosion is not the only challenge facing workers' compensation in the 21st century. COVID-19 is another. Workplaces have been a significant source of COVID-19 transmission. Healthcare workers are clearly the most threatened, but excess risk also applies to meat processing, hairdressing, childcare, public safety, public transit, teachers, and other occupations. States have exhibited substantial variation in how workers' compensation has dealt with COVID-19 claims, even among healthcare workers. A brief written by Academy policy analyst Jay Battelle highlights this variation. The Academy has a history of providing facts and analysis addressing challenges to workers' compensation systems. Since 1997, the Academy has published an annual report on workers' compensation costs, benefits, and coverage. In 2004, a NACI study panel published a book addressing the adequacy of workers' compensation benefits, laying out a structure for thinking about benefit adequacy and summarizing the state of knowledge. In the past 2 years, with the input of study panel members, Jay Patel has written a policy brief on opioid use, occupational injury, and workers' compensation. With the support and encouragement of Bill Arnone and Elaine Weiss, I expect that the Academy will continue to focus on these and other important issues. The challenges I've described provide the setting for an interview with John Burton, the chair of the National Commission. John has both a law degree and a PhD in economics from the University of Michigan. He's professor emeritus in the School of Industrial and Labor Relations at Cornell and professor emeritus at the School of Management and Labor Relations at Rutgers, where he served as dean. He's been a member of the Academy's study panel on workers' compensation since its inception and was its chair for many years. Most important, John is the wisest and most knowledgeable person I know about how workers' compensation systems function and how to make them better. Academy policy analyst Griffin Murphy and John Burton will now take us back 50 years to when John, probably at 12 years of age, was chair of the National Commission. Then they will lead us forward to today and beyond.
Good afternoon, John. Thanks for joining us today. I'm really glad to be here with you. So in our new year of 2022, it is the 50th anniversary of the submission of the report of the National Commission on State Workmen's Compensation Laws to the President and Congress. You were the chairman of that commission. Can you please tell me a little bit about the work of that commission?
Yes, I'd like to. The commission was created by the Occupational Safety and Health Act of 1970, and that act itself was passed with strong majority in Congress, bipartisan support. Nixon administration supported it. And as part of that act, there was a section that created the National Commission and required it to submit a report to Congress and to the President by July 31st of 72. There were 18 members of the commission, 15 were appointed by the president or the administration, and most of those appointments were Republicans, including myself. I was designated as a chairman because I was one of the few Republicans with academic experience in workers' comp, and so I fit one of the categories in the law. And we submitted a unanimous report on July 31st, 1972. Somewhat to, I think, surprise almost everybody, we made the scheduled time. And fundamental point of our conclusion was that we said workers' compensation laws in general are inadequate and inequitable. So a very strong condemnation, if you will, of the workers' comp program as of that year. One of the problems we came across as we held hearings and so on was that temporary total disability benefits, which is the most common type of cash benefit paid by the program, the benefits were less than the maximum benefits in states were less than 2/3 of the state's average weekly wage in 40 states. And indeed, in many states, the maximum benefit was below the national poverty level. So the National Commission made a finding of that the states were in problem, states had problems, and they made a number of recommendations. In fact, 84 recommendations in total. Here's a picture of our report, incidentally. You can see my copy's a little bit ragged after all these years, but that's the report as it came in. We had 84 recommendations. For example, to stay with the temporary total disability issue, we recommended that the maximum weekly benefit be no less than 100% of the state's average weekly wage. Of our 84 recommendations, we designated 19 as essential, and we agreed that states, if they were not in compliance with the essential recommendations by 1975, that Congress should enact federal standards requiring compliance with those 19 essential recommendations. So that was a surprise, I think, to many people that we, primarily a Republican-dominated commission, would recommend federal standards, but I guess it's a tribute to how times have changed.
No kidding. So 50 years have passed since that monumental report was issued. Can you tell me a little bit about the impact since then? I know that federal standards were never enacted based on my experience of the program, so you can talk a little bit about that.
Yeah, they were never enacted. There were a couple of efforts during the 1970s. Senator Williams and Javits, for example, introduced legislation that failed. I actually testified against it. I thought it was overreaching. Essentially, by the election of the President Reagan in 1980, there's never been a serious effort or to enact federal standards. So that is, I think, a disappointment for those of us who hoped that there would be some federal standards in the program. Having said that, states have significantly improved their laws during the period since 1972. In 1972, for example, of the 19 essential recommendations, states on average complied with 6.7 of them. And by 1980, the compliance score had gone up to over 12 per state, complying with the 19 essential recommendations. And to give an example on that, I mentioned before the maximum temporary total disability benefits being low in 1972. By 1980, there were 32 states that had maximum weekly benefits that were at least 100% of the state's average weekly wage.
That sounds like some progress to me.
No question there was progress during the 1970s. I think since then, since essentially 1980, things have been pretty much slow during the rest of the 80s. And then by the early 90s, a substantial decline in benefits and coverage and so on has occurred in the program. So one of my members, one of the persons I've known for quite a long while, dubbed the 1970s as the age of Reformation, and beginning in the 1990s was the era of counter-reformation. So I think that kind of catches what's happened over the 50 years.
Sure. So as you know, and you were a large part of making this happen, one of the Academy's main roles now is our annual report on workers' compensation data. And in general, I know we still have struggles with data, but I would like to think that the data on workers' comp is better than it was 50 years ago. So can you talk about research developments that have occurred since the Commission's conclusion in 1972 that workers' comp benefits weren't adequate then?
That's right. Well, I also might mention that for a long time, the Social Security Administration used to have an annual report on workers' compensation, and they discontinued that 20 years ago or so. And at that time, the National Academy of Social Insurance took over the responsibility for producing the basic data on the program. Now, there's a couple of developments since 1972 that I think are relevant for this question of how adequate and equitable the program is. One of them is that the National Commission has stated that the coverage of occupational diseases or work-related diseases should be substantial. And we included a table prepared by the Department of Labor that showed that 41 states as of 1972 were in compliance with the standard that the Department of Labor was using. And so we were pretty content with the status of coverage of diseases as of the date of submission of the report. Within a year or two after the report came in, studies began to come out, including one by Professor Barth and Professor Hunt, or Mr. Hunt, Dr. Hunt, indicating that in fact there was substantial gaps in the coverage of occupational diseases. And more recent studies have suggested that probably 90% of all work-related deaths do not qualify for workers' compensation benefits because of rules in the state programs that make it difficult to obtain those benefits. So I would say one of the things that was, in a sense, misleading about the National Commissioner's report was that it was overly generous in attributing coverage of state laws to covering diseases. We now know that's not the case, and in a sense, is likely to have, it certainly has resulted in inadequate and inequitable benefits. The other thing that has happened that is of major significance in 1972 is that at the time the National Commission put its report in, we were not able to reach a consensus about aspects of the permanent partial disability program. That's the most expensive type of benefit, and we wrestled with it, but in the time we had, we simply could not come up with recommendations. Since then, two things have happened that relate to the issue of adequacy of permanent partial disability benefits. One is that the National Academy of Social Insurance appointed a committee that was asked to look at the adequacy of workers' compensation benefits and to develop a standard. And indeed, that report, which came out, I believe in the late 90s or early 90s, said that permanent partial disability benefits should replace at least 2/3 of lost wages in order to be considered adequate. Now, another development that's occurred since 1972 that pertains to permanent partial disability benefits is that a new methodology has been developed to measure adequacy for workers' compensation cash benefits. It's a methodology that relies on drawing large samples of actual injured workers, finding out what happened to their wages as a result of their injuries, comparing those lost wages to the benefits they received from the workers' compensation program, and in a sense calculating what are called replacement rates. What's the rate of loss of wages that is replaced by workers' comp benefits? It turns out that these wage loss studies have been very critical, in a sense, of discouraging, I guess, about the adequacy of permanent partial disability benefits. A study that, a survey of these studies by Les Bowden suggested that the states that have been looked at in this thing, and the replacement rates range from 30s to 40% of lost wages being replaced by benefits. And so I would say the bottom line on this is that permanent partial disability benefits, which are the most important part of the program, most expensive part of the program, are in fact very inadequate, much more than we would have presumed, I think, in 1972. And it reinforces the notion that that the federal standards or some improvements in the law would be necessary to induce adequate benefits. Now, so that's my conclusion. I would say, if you want to say, the National Commission 72 said that laws in general were inadequate and inequitable, I think the same conclusion should be reached today based on the evidence we've seen from the wage loss studies and other studies of the program.
Well, maybe with all this new information, it's time for another commission, but we'll see whether any administration takes interest in that.
Well, I'm skeptical that that's going to happen. There's been talks about, and people have proposed it, but especially given the fractured nature of the Congress, I can't imagine there'd be a commission that would come anywhere near having a unanimous report on the problem.
Sadly, I tend to agree. So you're saying there were inadequate benefits then, you're saying there are inadequate benefits now. Could you talk about what you all concluded the source of inadequate benefits was?
Well, I think the source that was identified by the National Commission is one of our more important contributions, because we spent a lot of time and space in the report dealing with this issue. The problem we have is that the states are in competition for employers. And one way they compete is by reducing cost of workers' compensation. And there's no magic way to reduce cost of workers' compensation other than by cutting benefits. So we have essentially a competition among states to attract workers, to attract employers by cutting back on the adequacy of workers' compensation benefits. The National Commission said, and I agree with this, that there aren't that many employers that are probably going to move from one state to the other because of the cost of workers' compensation. But the problem is what this commission dubbed the specter of the vanishing employer, namely that if you go to a state legislature and somebody proposes to improve the state workers' compensation law, inevitably there will be an employer representative who will stand up and say, well, if you do that, we're going to lose all our employers to other states. And state legislatures are convinced by this specter of the vanishing employer that, in fact, they can't have an adequate workers' compensation law. So there's a race to the bottom that occurs in workers' compensation and has been occurring. Temporarily, the National Commission report in its proposal to have federal standards to put a damper on this amount of competition held back that race to the bottom. But since 1990, I would say it's reemerged as a driving and dominating force in changing state laws.
Would you say there's any evidence in states where there are higher benefits that employers do in fact leave?
No, I don't think there's much evidence of that. There is evidence that higher benefits are associated with higher cost. But I think you're talking about 1 or 2% of payroll, which is, much less than the differences among states and wages are much dominate that. So I don't think it's a major factor, but as I said, it's easy to convince employers that if you do this, why you're going to lose employers to other states. I remember being at a conference in Tennessee over 10 years ago. Turns out Tennessee has 8 contiguous states. And I made the point that, I think it's the most of any state in the country. Inevitably, you're going to find one state that's lower than Tennessee could be held up as an example. I propose as a federal standard that no state could have more than 3 contiguous states. But that proposal has gone about as far as the recommendations made by the National Commission. Obviously, I did that with tongue in cheek.
So we've talked a lot about the inequities and the inadequacies of the current system and the past system, honestly. Can you talk about your vision of the future of workers' compensation in the United States?
Yes, I'd like to quote from a younger scholar wrote something in 1965 who said, despite the possibility of the enactment of federal minimum standards, I feel that what will probably occur in workers' compensation in the immediate future will be a macabre shuffle. Reform will occur on a piecemeal basis, but with each state held back because the drag of inadequate laws in most other states. We are a nation basically dedicated to capitalism. But when the workers' compensation system was adopted in America, we were constitutionally forced to regulate on one byproduct of industrialization at the state level. The combination of capitalism and regulation inevitably led to interstate competition for employers by depressing workers' compensation costs. Under these circumstances, there may be no solution to the dilemma inherent in concurrently pushing capitalism and pursuing capitalism and an effective workers' compensation system.
Well, based on the state of things today, I think that scholar had some incredible foresight. And who was that young scholar?
That was from my PhD dissertation.
Well, there you go. Well, thank you so much for joining me today. I hope we're planning on doing a few spotlights this year on the Black Lung program, on COVID-19, which you talked about a bit, and on the Tennessee Reform Act, which funnily enough, you mentioned Tennessee as well. So hopefully the Academy can help push for positive change in the workers' comp space. I know that's a goal of mine and others on our staff.
Well, I hope the National Committee, I hope the NACI has impact, a positive impact. I think the report itself has been a very useful document. It's grown over time to be much more inclusive. I'm quite proud of what the NACI has done on that. So it is a major help. And as I mentioned before, one of the crucial documents in the whole discussion of partial benefits is due to a report that the that NACI put out, defining what we meant by adequacy of PPD benefits. But there's a role for the National Academy, and I look forward to participating to the best I can and helping that role be satisfied.
Oh, you've certainly been a tremendous help over the past decades, and I hope many of our members out there will step up as well. Thank you so much for joining me today, John.
My pleasure.
Hello, this is Jennifer Wolf. I'm the Executive Director of the International Association of Industrial Accident Boards and Commissions, and I'm the incoming chair of the Workers' Compensation Study Panel. As Les and John both highlighted, workers' compensation has many distinctions. It was the first social insurance program in the United States. It's entirely state-based, and coverage in the United States is largely provided by private insurers. It is also, unlike Social Security or Medicare, a program that most people don't know about until they need it. But when an injury at work does happen, workers' compensation plays a vital role for an individual and his or her employer. It provides wage replacement, medical care, and in the best cases, a return to full employment. It may be these distinctions and others that has resulted in workers' compensation being more siloed and less studied than other social insurance programs. As we have just heard from Professor Burton, there has only been one time in its history, during the years of the National Commission in the 1970s, when there has been a spotlight on workers' compensation. As we commemorate the 50th anniversary of the National Commission's report, we are also reflecting on how the last 2 years of the pandemic has brought occupational safety, health, and workers' compensation laws into our conversations about work, where they have long belonged. Indeed, today, as we begin 2022, it may once again be an opportunity to spotlight workers' compensation systems across our nation. For the last 24 years, NACI's Workers' Compensation Benefits, Costs, and Coverage has been the only publication to offer a complete picture of workers' compensation benefits, costs, and workforce coverage across the United States. I am honored to begin serving as the chair of the Workers' Compensation Study Panel as we begin work on the 25th year of this report. We have added new voices to the panel, giving us more diverse perspectives on how workers' compensation works and doesn't work for employees and employers. I'm excited that the 2022 publication will also give us the first look at how COVID-19 has impacted workers' compensation systems across the US. I'm encouraged that the Academy is bringing workers' compensation into more conversations across its body of work. As we've heard from Professor Bowden, workers' compensation is a program that exists within many disciplines: income security, healthcare delivery, public health, economics, the law, and so much more. There is no organization better positioned to leverage the knowledge of experts across health, safety, and income security than the Academy. Bringing together experts both within the workers' compensation community and across other social insurance disciplines will help us better understand workers' compensation, measure the impact it plays in the lives of employees across the country, and identify ways to strengthen its future. I'm excited to hear from Elaine and Jay about the multiple other projects being planned to enrich our understanding of workers' compensation and the role it plays bringing security and stability within our economy. And I look forward to meeting and working with you more as we explore these in 2022. Thank you.
Thank you so much, Jennifer. As Jennifer said so eloquently and really with so much enthusiasm, we're so lucky to have her on board. We look forward to commemorating the Commission's 50th anniversary and to leveraging this newfound and, dare I say, almost unique focus, public focus, policymaker focus on workers' compensation, and to further expand the Academy's important footprint in this space. The projects that we have planned for this year and beyond as part of our campaign reflect the interactions of workers' compensation, as Les, John, and Jennifer all highlighted, with the areas of healthcare and delivery, public health, disability, and others, and help advance economic security. Jay and I are very excited to briefly describe some of our ambitious plans. And as you'll see, there is lots of space for you and the many members who could not join us today to collaborate with us on them. Next slide. Two of the first products that we're working on reflect the importance of healthcare aspects of workers' compensation. And we also see these as extremely timely. The first of these is a spotlight on the Black Lung Program, which is being authored by Les Bowden. This piece speaks to the challenges that workers' compensation has encountered from the very start of covering occupational illnesses or occupational diseases. And it also looks at the balance between worker safety and the role of workers' compensation when that safety is compromised. And then within that raises issues of corporate responsibility that are also in stark relief right now and at the forefront of public conversation when it comes to COVID-19. Speaking of which, a new COVID-19 spotlight, which Jennifer is spearheading, will be building on the fantastic fact sheet that Jay produced last year. This spotlight will provide an updated look at how various states, and again, the hallmark of workers' comp, as we heard, one of them, unfortunately, from Professor Burton, is that there is such extensive disparity among states, in large part because there really is no federal rule, no federal floor, no federal mandate, no federal guidance as to what states need to do. And so there's massive variation in how states are addressing the complex issue of COVID-19 in the workplace. And of course, it again looks at more broadly at the treatment of occupational diseases. And with that, I want to give a shout out to a member who's not here, but who has been so helpful throughout the years in our workers' comp work and continues to be Misha Dworsky at RAND. Both of these spotlights will illuminate the connections of workers' comp to other social insurance programs and to broader economic security issues, and show the close interconnections between health security and income security. Next slide.
This year, we also plan to revisit and update the opioids fact sheet that we published last year. It came about from a small 2-sentence information we got from the DO report stating that fatal workplace deaths had increased for the 5th, or at this point, 6th year in a row. And when we investigated, a lot of information on the opioid overdoses in the workplace came up, and this is kind of where this fact sheet was born from. Unsurprisingly, just in 1 year, there hasn't been a magic change in this epidemic. Like, the opioid epidemic is continuing to ravage the country, and in fact, it's getting worse. They said that recently fentanyl overdoses are now the #1 cause of death amongst U.S. adults aged 18 to 45. So this just shows that updating this fact sheet is more timely and more crucial than ever. And we want to incorporate new research that both has been published recently, including the DOL's Women's Bureau's work on opioids and its impact on women in the workplace, and also research that we may have excluded or found out recently about. And we will also look at some of the new policy options that have been proposed or used by certain states to combat opioids in the workplace, and examine whether workers' comp is really the right vehicle for healthcare delivery, which is something that Elaine will talk about next. Next slide, please. Thank you.
Thanks, Jay. So we, again, in recognition of the close interconnection between health security and income security, we'll be having a whole series on the aspects of healthcare and how workers' comp affects them. And closing out that series, or I might even say capping off that series, I think is the better way to describe it. We will be producing a policy brief that explores an issue that to us is long overdue. And that is looking at this pretty fundamental question of whether workers' compensation is a good vehicle or the right vehicle to even deliver healthcare for injured workers. It raises some really interesting and thorny issues. There are a lot of perverse incentives that are built into this system that suggest that maybe this isn't the best way for either workers or employers for healthcare to be delivered. That healthcare is often disjointed in nature with lots of different providers. It can be complicated for providers. It can be complicated for patients. And it is often delivered in a somewhat combative way that is not the most conducive. I, again, want to give a shout out here. This piece will be building on really excellent research conducted last summer by our wonderful intern, Humphrey Shen. And Humphrey provides a superb example of how academy internships can help cultivate the next generation of social insurance and workers' compensation experts. Next slide.
Something else that John had touched on and that we'll be spotlighting is the Tennessee State Spotlight. We decided on Tennessee because during the course of our report, Griffin and I, when we were collecting data, we noticed, not just in this year, but in the past 2 years as well, huge declines in benefits for workers. Actually, from 2013 to 2019, benefits per $100 of covered wages fell by 53%, by far the largest decline by wide margins of any other state. So this provides a really interesting look at what happened there and what's causing this. All of this coincides with the passing of Tennessee's Workers' Comp Reform Act of 2013. So Griffin in the Spotlight is going to look at is going to review all the changes this act made, and then examine what factors could or could not explain the immense decline in benefits. And he's going to review each one. So he's going to look at all the changes made by legislation, as well as factors like workplace accident rates, claim filing, and a few others. Ultimately, what the Spotlight illustrates is kind of how disparate state programs are, and how thin worker protections can easily become, and relates back to the Commission's vision of a stronger federal role in workers' comp. Next slide, please.
So in addition, again, we have a lot going on in workers' comp. For those of you who think we don't do a ton, we have a lot going on. And in addition to the many smaller and kind of more discrete products that Jay and I have been talking about, we're also exploring some larger and even more ambitious projects, because of course, this is the Academy and that is what we do. In keeping with our broader commitment to looking at and addressing racial disparities across the social insurance ecosystem, we are assessing the potential for a large project looking at those impacts, particularly in the workers' comp space. This project, as we conceive it, would combine a really comprehensive literature review looking at the various ways in which racial disparities show up in workers' compensation and in which systemic racism has affected workers' compensation legislation, implementation, access, benefits, etc. This, of course, is part of the Academy's broad commitment to facing head-on the realities of racial disparities and systemic racism within social insurance, and taking a leading role in both raising and addressing these very tough questions. Next slide.
Heading in a new direction for us, another new direction, is the creation of a workers' comp database. So we have over 30 years of workers' comp data that's inaccessible to the public through our report each year, the data collection process that we do. And it's only accessible really through physical copies of the report or PDF copies online, which is not very accessible. We usually have many requests each year for data requests, like in a spreadsheet or the raw data before it's used in our calculations. So what we have been thinking about and want to do is develop a public-facing database that will allow researchers, policymakers, and anyone else who's actually interested to access the unique data set that we have. So we're just starting to explore and talking to different experts on what programs we could use, who the audiences could be for such programs, and whether we could use the same programs or software to both have a external facing database for the public, but also streamline some internal processes that on our side. So if anyone has, because this is so new, if anyone has any interest or expertise in this, please reach out to me or Griffin. We don't have the expertise for this, so we're kind of trying this out by ourselves right now and looking it up, but we could use some direction and pointers if you have any. Next slide, please.
And of course, as usual, we will be producing a wonderful report. I want to say thank you here to John Burton, who's been part of doing this report literally since the inception, as was noted. And as he also noted, on top of producing the only data on this that's available at all in the country, we have really been expanding the report every year to include analysis, discussion, to try to dig into kind of why we're seeing the trends we're seeing, what are the drivers behind them, how can we better understand them. We will be continuing to do that this year. And as Jennifer noted, also a big deal this year is that for the first time, we will have COVID data in this report, because this report will go through 2020. So we'll start seeing the first impacts of COVID in the various states, which we are looking forward to and have been gearing up for. I want to take this moment to give a big shout out to 3 institutional partners who've been really foundational to our being able to do this work. NCCI and AM Best, who ensure that we have the data we need to produce this report and the full data set that Jay talked about. And of course, IABC, where Jennifer's leadership has helped us gain more data from more states in the past few years, and of course, given us Jennifer. Final slide.
And then as we do in each year, we continue to work with the study panel and other Academy members to identify new projects. And one such project was the intersection of workers' comp and disability policy, like DI, SSI, and others. In our other task force, a COVID task force, we have 2 experts one talking about disability policy and one about workers' comp. And there was a discussion in their email chain where they just started discussing the intersection of it and how complex it is and how little it's been explored for what you would think there'd be a lot more new research in this area. It hasn't really been explored as much as you would think. So that's something that we really want to go ahead and dive into and see what we can find. So we really welcome your participation and suggestions. If anyone is interested in working on this or is available as a resource for me, Elaine, or to reach out to, please email us, and we would definitely be very grateful for your support in this as well. And with that, I guess we'll segue into Q&A, Elaine, unless there's something else.
Yes. Thank you so much. Before we go, I also just want to give a huge shout out to CMS, which has been supporting the production of this report for many, many years. And I really want to say a special thank you to literally like the staff, the career staff at CMS, who've been so helpful to us in navigating. So I know you're not here on this call, but just want you to know how much we appreciate you. I want to end this session with a really wonderful announcement that I've been bursting to make now for a couple of weeks, but it wasn't ready to be popped until now. Of course, want to give a huge thank you to Les Bowden, who heroically stayed on his chair for multiple years, shepherded us through some real transitions on the workers' comp team, and as you can see, landed us in a really solid place where we are poised to do some of the most ambitious work that we've done in years. Huge shout out to Jennifer for stepping up, for working with Les this past year, for already making it a pleasure, and for already making it easier for us to reach more states and get better, stronger data than we have in many, many years. But of course, today is most especially about honoring and thanking John Burton, who we can only describe as the Bob Ball of workers' compensation. Without John, so much of this would not be possible. So we are delighted to announce that the Academy is launching a new summer internship in John's honor. Going forward, we will be having a John Burton summer intern devoted to doing workers' comp work, and as part of our leadership development aspect, helping to nurture and grow the next generation of fantastic workers' comp experts. Yay, John. And while we are at it, want to give a huge shout out to longtime member, supporter, study panel member, and all-around champion, Dave Torrey, who already made the first donation to help us fund this internship. So for all of you who are inspired, feel free to let me know that you want to donate. For those of you who are inspired by Jay and me and by John and Les and Jennifer, reach out.